Welcome to Proper Lifting. Please print the Proper Lifting review sheet to fill out as you view the following slides. Most of the time when we think of lifting, we think of work in a warehouse, lifting boxes, or maybe being in a gym doing some weight training. Would you believe that the Occupational Safety and Health Administration states that sprains and strains are the most reported injury for caregivers, with the shoulders and lower back being the most affected part? When we're doing things like helping someone sit on a toilet, assisting someone out of a chair, or transferring a supported individual from one bed to another, we're using the same body mechanics you'd use when lifting a box. In the routine of completing daily tasks, it's easy to forget to pay attention to how we are performing those tasks to stay safe, especially when we're focused on the well-being of others. The small bones that form the spine are called the vertebrae. Most back pain occurs in the lower back and includes the 5 vertebrae in the lumbar region. This area supports most of the weight of the upper body. The spaces between the vertebrae are maintained by a round rubbery disc that acts like a shock absorber to cushion the bones as the body moves. As we age, these discs wear down and lose their cushioning ability. A herniated disc, also called a ruptured or slipped disc, can occur when a disc is compressed, causing the jelly-like substance to leak, irritating the nearby nerves. The back is a complex structure of bone, muscle supported by cartilage, tendons, and ligaments, and fed by a network of blood vessels and nerves. The spine supports the trunk and head and gives flexibility to the body. It also protects the spinal cord. When you strain your back, you've stretched or torn a muscle or tendon. Tendons attach bone to your muscle. When you have a sprain, you've stretched or torn a ligament. Ligaments connect bone to bone. An injury can take place after an accumulation of issues. If you've had previous back injuries or poor back health over time, then you can experience an injury when the back has reached its limit. In that case, the movement doesn't necessarily have to be exaggerated or involve a heavy object. You can hurt your back grabbing a paperclip off the floor or loading a dishwasher. A higher proportion of injuries occur at the end of the shift due to fatigue. There are several ways you can take steps to reduce the likelihood of back problems. One of the simplest ways is to stay hydrated. Our bodies are made up of approximately 70% water. Drinking plenty of water enhances the height of the discs between the vertebrae, allowing them to be the effective shock absorbers that they are. The blood flow to the discs reduces with age. Exercise can assist to alleviate back pain by increasing the blood flow, relaxing muscles, and increasing flexibility. Smoking increases the risk of osteoporosis, a serious disease that causes loss of bone strength. Smoking reduces blood flow that provides nutrients to the bone cells. The discs can break down due to the reduced nutrients. If you're injured, smoking can also get in the way of the healing process by impairing the immune system functions in your body and increasing inflammation. Here are a few simple exercises that can be beneficial for your neck and back. The first one is the shoulder shrug. The main muscles that shoulder shrugs target are the muscles located on either side of your neck. They control the movement of your shoulder blades as well as your upper back and neck. When these muscles are strengthened through exercise, you'll have an easier time maintaining proper posture, which helps stabilize your neck and upper back. Everyday movements such as lifting, reaching, bending, and even sitting are more efficient and safer when these muscles are toned and strong. This exercise can also provide some stress management. We often carry stress in our shoulders and neck and don't even realize it until we focus on relaxing those muscles. To do a shoulder shrug, start with your feet flat on the floor, in a standing or sitting position with your arms at your side. Keep your chin up, facing straight ahead, and your neck straight. When you inhale, bring your shoulders up as high toward your ears as you can. Do the movement slowly so that you feel the resistance of your muscles, and hold for 10 seconds. Exhale as you lower and relax your shoulders back down. You can repeat this several times. Another exercise is the single knee to the chest. Hip tightness is a frequent contributor to lower back pain. In order to stretch the hamstrings, lower back, and glutes, lie on your back with one knee bent and one leg straight. Place hands behind the leg and pull back towards your chest until a light stretch is felt down the back of your leg. You can also place your hands over the bent leg on the shin or knee and pull towards your chest. Hold for 30 to 60 seconds. Switch legs and do the same thing. Repeat 3 to 5 times for each leg. The pelvic tilt can increase core stability. Lack of core control and stability is a key player in lower back pain. When the abdominal muscles are not performing, the muscles of the lumbar portion of the spine have to work harder to stabilize the body. An excellent way to improve core stability is to lie flat with the knees bent up. Tighten abdominal muscles as if bracing for a punch to the stomach, and press the small of your back into the floor. Hold this contraction for 10 seconds and repeat 10 to 20 times. You can either have your arms resting by your side or behind your head, depending on what's more comfortable. With this stretch, it's important to remember, keep your feet flat on the floor, keep your shoulders pressed to the floor but relaxed. Do not hold your breath as you perform this exercise. Improving hip flexibility and core stability, as well as lengthening the back muscles by stretching, can help reduce the symptoms of lower back pain. In the next slide, you'll see a video showing you how to identify those important core muscles and a couple more simple exercises.
Hi, welcome to Healthy Fitness Friday. I'm Donna Nomdron Reynolds.
And I'm Tora of donnaandtora.com.
Well, today what I'm going to talk to you about is your core. Now everyone talks about the core, they band it around, but what is it really? And how do you identify it? And what are the 2 simplest exercises you can do? That's what we're going to talk about today. So Tora's going to help me, we're going to help each other. So let's talk about what the core is, okay? A lot of people think the core muscles are just these muscles. No, they're part of a group of muscles, your core. 4 most important, okay? You've got the top, you've got your diaphragm, you've got the bottom, you've got your pelvic floor, okay? You've got the front, which takes in the sides, that's your transverse abdominis, and they're the deep ones, not your 6-pack that we love to build up. And you've got your back ones, multifidus, and they're the tiny little ones that hold the spine in place at the back, okay? So I like to liken your core muscles to a car, or your body to a car. The car is hard on the outside, isn't it, Tora? And it protects you from impact. Yep. But inside the car, if you don't have any restraint on, and you get hit, you're going to bounce around. And that's what happens inside here. So you've got your 6-pack muscles here, and they protect you from something poking you or prodding you, but they don't protect anything inside. They're too far away from the inside organs and your spine. Okay, so you've got a seatbelt in your car to protect you, but really inside your body, that's not enough, you know? So think about a roller coaster. You sit inside a car in the roller coaster, and this restraint comes down over your head, and the scarier the roller coaster is, the bigger these things are, and you can hardly put your arms around them, okay? So if you think about the seat of the roller coaster, that's like your pelvic floor, it's pushing you up and giving you that support. The back of the seat, where the restraint pushes you really hard up against the back of the seat, that's your multifidus, your back, deep back muscles. And here, the front of the restraint, that's your transverse abdominis, and up the top here hold you in, your shoulders in, so you don't slide out when you're going upside down. All right? So that part there is your diaphragm. So they're the most important components of your core. So let's move on to how do you identify your core muscles, okay? So easy to turn on these big muscles outside and think you're turning on your core, but you're not, okay? So how do you find them? What do you feel for? Now, if you take your hips here, and you know the bony bit at the front there, you've got one here and one here. If you put your fingers on the inside there, now stick your fingers inside your shorts there, Tora, and feel in there, that's your transverse abdominis, okay? So it's really important to try and turn it off, make your tummy all flabby, okay? Feel it soft, and then turn it on, okay? No other muscle goes across there. There's a few other ligaments and so on, but they're not going to turn on and off as much as your transverse. Okay, so another way of identifying your core muscles in your back and your pelvic floor is to find something that's shoulder height for you. For me, it's the whole of your microwave. Put your hands there. You can find someone else. You can put your hands on their shoulder, and if they don't mind you pushing down on them hard, then go ahead and do that, okay? So what you do is you need to pull up your pelvic floor and push down, straight arms, and you're pushing down, and you'll turn on all those muscles. Why don't you give it a go, Tora? Breathe. Can you feel them?
Yeah.
Okay, you're not holding your breath, because if you hold your breath, that creates some pressure in your abdominals as well, and it can give you the feeling of turning on your core, but you're not, so you've got to breathe through it. Try again, one more time. Okay, can you feel them all turning on around? Oh, I can see it, I feel it. There you go, okay? That's the easiest way. So now we're going to show you, we're going to get down on the ground, and we're going to show you 2 ways of exercising the core muscles. So we're back. I'm going to show you the easiest exercise for your core muscles, and you can do this in sitting, all right? So if you're at the office or whatever, do it. All right, so Tora is going to show us. She's going to sit up straight on her sitting bone. She's going to pull the flesh out away from her bottom and sit up straight, tuck your chin in, okay? Keep good posture every time. And what she's going to do is just lift one knee up, keeping her body completely still and straight, and alternate the knees up and down. Pull in your pelvic floor, Tora. Okay, breathe. So simple. All right? Now to make it harder, put your hands on your knees, Tora, and just provide a little bit of resistance down, okay? Can you feel the difference?
Yep.
Yep. Do you feel it into your core?
Yeah, it's good.
That's good. Pulling your pelvic floor is really important, and this goes for men too. Pelvic floor is bandied around for women often, but it's really important for men as well. Okay, so we're going to get down on the ground, and Tora's going to show you how to do a plank. Now we're on the ground. I'm going to show you how to do the plank with Tora demonstrating. Just lie down flat. Okay, bring your elbows in underneath your shoulders. Okay. All right, feeling comfortable? You can hold your hands if you like, or like Tora's got them flat on the ground. And all you're going to do in the first movement, if you could bring your knees in together a bit more, Tora. Okay, first movement is just simply lifting your pelvis up so you're on your knees, okay? And then what you do is bring your toes under and just slightly raise your knees up. Okay, and what Tora likes to do is to rock back onto the balls of her feet. And that is a great plank. Now if Tora can bring her chin in a little, keep her neck straight. There you go. Perfect. And it's so easy to do if you know the position to go into. Thanks, Tora. Okay, so we've talked about the core and what it really is, and just keep remembering the roller coaster. You've got your pelvic floor, you've got your back multifidus, you've got your transverse abdominis and your diaphragm. Remember to always breathe. Tora's demonstrated the seating exercise. You can use that anywhere, and the plank is great for progressing even further. So thank you for joining us here today, and please keep your fitness healthy.
And thank you, Donna, for giving us those great tips. This is from Donna, who is a trained physiotherapist, so hear it from an expert who knows exactly how to do these really important key exercises. So feel free to comment below on this video, and in health and happiness. See you next time.
In the next few slides, we'll review 5 common causes of back pain and steps you can take to reduce the risk of back injury. Back strain can happen from a sudden trauma, such as an accident or a fall. In some cases, the sudden impact happens due to not paying attention. Have you ever stepped off a curb or down a step that was deeper than you expected? That sudden movement can put a strain on the lower back muscles. Other times, we may not have prepared our bodies for what we want it to accomplish. Examples of that might be jumping into a hardcore workout the first day back to the gym, or gardening all day, or even joining a volleyball game at a family reunion when we usually don't play. Stretching ahead of time and pacing yourself during a new activity can help. Poor posture can contribute to the abnormal wear of joints, resulting in stress to the ligaments that hold the joints of the spine together. When this happens, the muscles are being used inefficiently, so it takes more energy and they become fatigued quicker. Having good posture contributes to the prevention of overuse and strain on the back. Sitting puts more pressure on your lower back than standing. If you're bent over a computer or cell phone, that adds to the problems for your neck, shoulders, and back. The best sitting posture is with your back straight, knees at a 90-degree angle with your feet flat on the floor. Get up and stretch once in a while. If you're concentrating on something or playing a computer game, set an alarm to remind yourself to step away for 10 to 15 minutes each hour. If you're sitting for a longer period of time at work or school or in the car, take the items out of the back of your pockets. This is the one you hear all the time. Bend your knees and lift with your legs, not your back. But there's a bit more to it than that. When lifting, keep the object close to you. The further away you hold an item from your body, the more it stresses your back. Avoid holding the object higher than your armpit or lower than your knees if you have to carry something and move it. Keep your neck and back straight. Lifting while bending over with a curved spine significantly increases the pressure on your back. Pretend like you have a pole running down your back from your neck all the way to the base of your spine. As you can see from the illustration, even weightlifters use this technique. It's something you'll want to remember if you assist with moving or lifting a person you're caring for, or when you're doing household chores, lifting a laundry basket, or working outside. One of the worst things you can do is to lift an object and then twist your spine. This can happen when you're lifting something and turn to move in another direction, or if you're shoveling dirt in the garden and twist your back to empty the shovel. Instead, you can avoid a back strain by turning your feet in the new direction after you've lifted the item, instead of turning at your waist. Back injuries often happen when we aren't paying attention to what we're doing. Maybe we're tired and forget to use a lifting technique, or get distracted as we step off a curb or down a stair step. Repeated strain on the back can build up over time until that one day you wake up sore, not knowing what specific thing triggered the problem. If you have some moving or lifting to do, take a moment to focus on the task to prevent injury. You can refocus by stretching or using the simple technique of taking a few deep breaths, inhaling through your nose and then exhaling through your mouth. If you have to move an object, check that the path is clear ahead of time and that you're aware of any changes in the flooring you might encounter during the move. The video on the next slide will give you some general information on how to safely transfer an individual from one place to another and how to properly use transferring equipment such as a gait belt or a Hoyer lift.
In this video, our subject is transferring patients and residents. We will discuss getting ready, safety considerations, how to transfer a person from bed to wheelchair, how to transfer a person from wheelchair to bed, how to transfer a person between bed and stretcher, how to transfer a person using a mechanical lifting device, and finishing up. As a nursing assistant, you will frequently assist patients or residents with transferring, that is, moving from one place to another. For example, those in your care may need to transfer from the bed to a wheelchair and back again, or between a wheelchair and a dining chair or commode. During transfers, you will need to keep your patients or residents safe, while at the same time protecting yourself against injury. By developing competence in assisting with transfers, and by practicing good body mechanics, you increase the chance that everyone will come through the procedure safely. Preparation, that is getting ready to manage your work in a manner that is safe, healthful, and efficient, is key to successful health care. No matter what tasks you'll be performing during your shift, whether those tasks are planned or unanticipated, you will benefit from a routine of careful preparation. Begin each interaction with patients or residents by performing these steps. Wash your hands. Gather all needed supplies. Knock before entering the person's room. Introduce yourself using your name and title, and greet the person by name, remembering that a friendly greeting helps establish rapport. Carefully identify the person adhering to your facility's approved method. Explain to the person the procedure you're about to perform, and make sure the person understands before you begin. If necessary, show visitors where they can wait outside the room. Provide privacy by closing the door and curtains. As appropriate, drape the person for modesty. And then, throughout the procedure, see to safety using proper body mechanics and following all safety precautions for equipment use and infection control. Here are some additional getting ready steps you should take whenever you transfer a patient or resident. Before you start a transfer, even a simple one, plan the transfer. Ask the nurse or physical therapist about any limitations the person has and what the recommended transfer method is. Get help from others if necessary, especially with heavy lifting. Consider using assistive equipment such as a transfer belt or mechanical lift. Make sure all wheels are locked on beds, stretchers, and wheelchairs to prevent the equipment from rolling out from under the person. And finally, move furniture out of the way before you start. No matter how thoroughly you carry out your getting ready steps, you must still pay close attention to safety during the transfer. Unfortunately, accidents are common during transfers, with potentially serious consequences. But if you follow a set of safety guidelines, such as those that follow, accidents can be minimized or even avoided altogether. To keep patients and residents safe during transferring procedures, follow your plan, whether you're working alone or with assistance. Remember to give the person clear instructions and encouragement throughout the transfer. Make sure the person leads with her strong side if possible. Make sure the person's clothing doesn't interfere with the transfer, and that shoes provide support and have non-skid soles. Have unsteady people grasp your arm or the arm of the chair for support. Do not allow the person to hold you around your neck. To help support the person, place your hands either on the transfer belt or behind the person's upper back. Do not place your hands under a person's armpits to help support her, because if the person falls, she may be injured when you lift up as she is falling down. It's important to note that some patients or residents may have medical conditions that make it dangerous to use a transfer belt on them. For example, a transfer belt should not be applied to a person who is recovering from abdominal surgery. Transfer belts are also not used with people with certain heart disorders. If you are in doubt about using a transfer belt on a patient or resident, ask the nurse. The key to your safety whenever you transfer a person, and another great way to prevent injury to patients and residents, is to observe good body mechanics. Body mechanics are the way you align, balance, and coordinate your movements, and they're as easy as ABC. A for alignment, B for balance, and C for coordinated movement. Think of the A, or alignment, as good posture. Keeping good alignment through good posture lessens strain on your joints and muscles. Specifically, good alignment keeps your back in a neutral position. B, or balance, involves a wide base of support and a low center of gravity. When you're standing, the base of support is your feet. Separating your feet makes your base of support broader. Your center of gravity is your torso, the heaviest part of your body. Bending your knees puts your center of gravity lower, closer to your base of support. This also takes strain off your back. C, or coordinated body movement, uses the weight of your body to help with movement. This might be as simple as straightening your knees, allowing the momentum of the movement to assist you in your task. During a typical workday, you are likely to assist with transfers many times. And because transferring consists in large part of lifting, you will risk serious injury to your back if you don't use proper technique. And back injuries can be painful. Moreover, they can be serious enough to end your career. You see, the muscles of your back are not designed to lift weight. That's why you see competitive weightlifters using their leg muscles, then their arms and shoulders. In other words, they use good body mechanics, and so should you. When transferring, you will vary the degree of assistance you provide depending on the person's ability to help with the transfer. That is, the person's ability to bear weight, and whether the person can bear weight on one leg or two. Perhaps you will only need to provide a steadying hand, or you may need to totally lift the person from one place to another. When helping a person to transfer, you must consider all factors that may affect the person's weight-bearing ability. For example, surgery involving one or both legs may limit the person's ability to bear weight, as will leg paralysis due to a stroke or other injury. In short, know your patient or resident and never assume anything about the person's abilities. Before proceeding, make sure you have checked to see what type of assistance the person will require. Then, make sure you use the proper equipment to assist with your transfers according to the specific needs of the person, using, for example, a transfer belt or a mechanical lift. Remember, a transfer belt is never used to lift a person who cannot bear weight. A person who is unable to bear weight should be moved with a mechanical lift device. For safety, make sure you have been trained in the use of these devices before you use them. Finally, you will complete your attention to safety when during the transfer you tell the nurse right away if the person complains of dizziness, shortness of breath, chest pain, a rapid or irregular heartbeat, or sudden head pain. The person complains of pain when he or she tries to bear weight and this is new. You observe any changes in the person's usual grip, strength, or ability. A usually cooperative person refuses to participate, and tell the nurse if the equipment is not working properly or is broken. To transfer a person from bed to wheelchair by yourself using a transfer belt, begin as usual by gathering your supplies, which in this case are a transfer belt, a wheelchair, a safety belt if ordered, and a lap blanket if needed. Lower the bed to its lowest position. Raise the head of the bed as tolerated.
Feeling dizzy at all?
No.
Okay, cool.
Then make sure the bed's wheels are locked for safety. Next, lower the side rail on the side of the bed next to the person's strong side. This is the side you'll be working from. Leave the opposite rail up. Fan fold the top linens to the foot of the bed. Now position the wheelchair next to the bed, facing the foot of the bed. If possible, brace the wheelchair against a wall or solid piece of furniture to keep it in place. Lock its wheels and position the footrests out of the way. Help the person to move toward the side of the bed where the wheelchair is located. Then, help the person sit on the edge of the bed. To do this, first have the person roll over onto her side, facing the side of the bed where the wheelchair is located. Have the person flex her knees and position her arms as shown to enable her to prop her upper body up and push off the bed. Now ask the person to rise to a sitting position by using the elbow of her bottom arm to raise her upper body while pushing against the mattress with her other hand. Advise the person to allow her legs to swing over the edge of the bed while you help guide her into an upright position. Next, allow the person to dangle or rest in this position for a few minutes before helping her to stand up. This helps equalize blood flow after a person has been lying flat for a long period of time. Make sure the person is sitting squarely on both buttocks with her knees apart and both feet flat on the floor. The person's arms should rest alongside her thighs. A note of caution: if the person is rushed through this step or not allowed to rest at all, she may become dizzy and fall while attempting to stand. So allow her to sit for several minutes before proceeding. Observe the person for signs of dizziness or fainting as you position yourself in front of her so you can offer assistance in case she loses balance. And remember to ask the person if she feels dizzy or faint.
Do you feel dizzy or faint at all?
No, I don't. I feel fine.
Okay.
If she does, assist her back to a supine position before notifying the nurse. Next, help the person put on her shoes or slippers and help her into a robe. For safety, make sure that clothing doesn't interfere with the transfer. When the person is ready, apply the transfer belt around her waist, over top of all clothing. Buckle the belt in front. Before you tighten the belt, turn it so the buckle is off-center, perhaps even off to the side. Tighten the belt and check for fit. It should be snug, but you should be able to slip your fingers between it and the person's waist. If you're putting the belt on a woman, make sure you do not trap her breasts beneath the belt. Next, assist the person to the place she is going, in this example, to her wheelchair. Help the person to stand by facing her and having her put her hands on the edge of the bed. Make sure her feet are flat on the floor. Then have her lean forward. Grasp the belt at each side, using an underhand grasp for safety. Position your feet alongside the person's feet, flexing your knees. Your shins will be against the person's shins. This technique helps to block the person's feet and keep her knees from buckling as she stands up. Have the person push down on the bed with her hands and stand on the count of 3.
On the count of 3, I want you to push down on the bed and try to stand, okay?
Pull on the transfer belt as you straighten your knees.
3.
Remember to keep your back straight. Support the person in the standing position by holding the transfer belt or by keeping your hands on her shoulder blades. Continue to block the person's feet and knees with your feet and knees. Help the person to turn by pivoting on the stronger leg toward the chair. This will allow the person to grasp the far arm of the wheelchair. Make sure the backs of the person's legs touch the edge of the chair. Continue to assist the person with turning until she is able to grasp the other armrest. Then, gently lower the person into the wheelchair by bending your hips and knees. Make sure the person's buttocks are at the back of the chair and that the person is comfortable and in good body alignment. Now, remove the transfer belt. Position the person's feet on the footrests of the wheelchair. Buckle the wheelchair safety belt if one was ordered. And cover the person's lap and legs with a lap blanket if desired. But make sure the lap blanket does not drag on the floor. Position the wheelchair according to the person's preference. Then complete your finishing up steps as described in the final section of this video. To transfer a person from a wheelchair back to his bed by yourself and using a transfer belt, begin as usual by gathering your supplies, which in this case is a transfer belt. For safety, make sure the bed is lowered to its lowest position. Make sure the bed's wheels are locked for safety. Then raise the head of the bed. Fan fold the top linens to the foot of the bed. Then make sure the side rail on the working side of the bed is down while leaving the opposite rail up. Now you are ready to position the wheelchair. If possible, brace the wheelchair against a wall or solid piece of furniture to keep it in place. The person's strong side should be next to the bed. Lock the wheels of the wheelchair and position the footrests out of the way. Remove the person's lap blanket if one was used and release the wheelchair safety belt if in use. Next, apply a transfer belt as demonstrated earlier in this video. Now stand facing the person with your feet spread about 12 inches apart and with your knees slightly bent to protect your back. With your back straight, slide the person to the front of the wheelchair seat. Make sure the person's feet are flat on the floor. Grasp the transfer belt. Position your feet alongside the person's feet, flexing your knees. Place your shins against the person's shins to block his feet and to keep his knees from buckling as he stands. Have the person rest his hands on your arms and assist him to stand by pulling on the transfer belt as you straighten your knees. If the person requires less assistance, he can place his hands on the wheelchair arms for support and push off while you offer support. If use of a transfer belt is contraindicated for your patient or resident, you can assist the person into a standing position using a different technique. Place your hands on the person's upper back and gently pull him up and forward as you straighten your knees. No matter which method you use to assist the person out of the chair, remember to keep your back straight as you are doing it. Slowly help the person to turn toward the bed by pivoting on his strong leg. Then, help the person to sit on the edge of the bed. Now, remove the transfer belt. Remove the person's robe if appropriate. Then his slippers. Next, move the wheelchair out of the way. Place one of your arms around the person's shoulders and one arm under his legs. Swing the person's legs onto the bed. Help the person to move to the center of the bed. Then, position the head of the bed to the level that's comfortable for the person. Straighten the bottom linens and make sure the person is comfortable and in good body alignment. Draw the top linens over the person and make sure the call light control is within reach. If the side rails are in use, return them to the raised position. Then complete your finishing up steps as described in the final section of this video. Stretchers are used to transport people to other parts of a facility for surgery or diagnostic testing. Critically ill and comatose people are also transported on stretchers. To transfer a person from a bed to a stretcher, begin with your getting ready steps. You will need 3 co-workers to assist you, and you will need to bring a stretcher with a bottom sheet in place. You will also need a blanket with which to cover the person, and a lift sheet in position on the person's bed. After identifying yourself and your co-workers to the person, and after explaining the procedure, raise the bed to its highest level. If there aren't any contraindications, lower the head of the bed so that the bed is flat. Make sure the bed's wheels are locked. Lower both side rails. Then, fan fold the top linens to the bottom of the bed. If necessary, untuck the lift sheet in preparation for transferring the person. Position the stretcher alongside the bed. It should be slightly lower than the bed. Lock the stretcher wheels. If stretcher safety belts are in use, move them out of the way. Make sure the lift sheet is positioned so that it is under the person's shoulders and hips. As shown here, 2 assistants stand on one side of the bed facing their co-workers, who are positioned along the outside edge of the stretcher. All 4 assistants should grasp the edge of the lift sheet and roll it over as close to the person's body as possible. This will provide for a better grip. On the count of 3, all 4 assistants slowly, carefully, and in unison lift up on the lift sheet and move the person to the side of the bed. Then, again on the count of 3, All 4 assistants lift up on the lift sheet and move the person to the side of the stretcher. Next, position the person on the stretcher and make sure he is in good body alignment. Reposition the pillow under the person's head and drape him with a blanket for modesty and warmth. If necessary, buckle the stretcher safety belts across the person and raise the side rails on the stretcher. Raise the head of the stretcher as the person requests. Then, complete your finishing up steps as described in the final section of this video. For safety, always transport feet first and never leave the person alone on a stretcher. To transfer a person from stretcher to bed, you will reverse the procedure, making sure to observe all safety precautions. A mechanical lift is used to move people who are helpless or very heavy. Before using a mechanical lift, always make sure the person you need to transfer weighs less than the weight limit specified on the lift, and follow all your facility's policies on operating the lift. Many facilities require 2 staff members to operate a mechanical lift. Make sure you know your facility's policy. And though we're about to demonstrate the use of a lifting device, don't attempt this yourself until you've been trained on the device in your facility. Begin with your getting ready steps. Part of that is gathering your supplies, which in this case includes the mechanical lift, a sling, wheelchair, lap blanket if needed, and lap restraint if ordered. You should also ask a coworker to help. Begin by making sure the bed is positioned at a comfortable working height to promote good body mechanics. Make sure the bed's wheels are locked. If the side rails are in use, lower the rail on the working side of the bed. Fan fold the top linens to the foot of the bed. Using the same technique as when placing a lift sheet while making an occupied bed, place the sling underneath the person, positioning the sling between shoulders and knees. The sling's lower edge should be under the person's knees. Raise the lift so it can be moved over the person. Move the lift into position over the person. Then lock the wheels. Attach the sling to the swivel bar. Cross the person's arms across his chest. Raise the lift until the person and the sling are clear of the bed. Then raise the person. Place the wheelchair alongside the bed, facing the head of the bed. Lock its wheels and position the footrests and armrests out of the way. Turn the person so he is facing the mast of the lift and his body is centered over the base. Next, unlock the wheels of the lift and move the lift so the person is over the seat of the wheelchair. Spread the legs of the lift apart as necessary in order to straddle the wheelchair. The person's back should face toward the wheelchair. Next, gently lower the person into the wheelchair. Make sure the person's buttocks are at the back of the chair. Release the sling from the swivel bar. Then move the lift out of the way. Leave the sling under the person so it's ready for his return to the bed. Reposition the wheelchair's footrests and armrests and put the person's feet on the footrests. If a lap restraint was ordered, position it now. Otherwise, provide a lap blanket as needed, making sure it doesn't drag on the floor. Finally, position the wheelchair according to the person's preference. Then complete your finishing up steps as described in the final section of this video. When you have finished with a procedure, always follow a routine of finishing up to ensure your patient's or resident's safety and comfort. First, confirm comfort and good body alignment, whether the person is seated or in a bed. Leave the person's call light control within easy reach, and do the same for any other items the person may want, such as remote control devices, the telephone, or fresh water. Next, see to safety. If appropriate, return the bed to its lowest position. Then, make sure the wheels are locked for safety, and place the side rails in ordered or requested positions. If desired, open the curtain or door and ask whether the person would like for visitors to return. If you used gloves, first discard them according to your facility's policy. Then, wash your hands. Finally, report and record all pertinent information about the procedure, including the date and time of the procedure and your full name and title.
When using lifting equipment, make sure to use the appropriate tool for moving the individual. Consistency is also important. When the lifting technique is consistent, the individual is more likely to cooperate and be less anxious. The Hoyer lifts at Home Life are manual hydraulic lifts. They use hydraulic fluid as the force to move the hoist mechanism. A simple crank is attached to pump the fluid to provide the lifting force. Never leave someone unattended in a Hoyer lift. The lifts are only intended to move a person from one stationary place to another, like moving someone from a bed to a wheelchair or a wheelchair to a shower chair. Do not use it to transport someone down a hallway or to the bathroom. The Hoyer lift can actually tip over if it moves over a change in flooring. To review, the following things can have a negative impact on the back: trauma, sudden movements, or repetition; poor posture; poor physical condition; aging and disease; incorrect lifting; and smoking reduces nutrients to the discs that support the back. Exercise, stretching, and hydration are good preventative measures for back health. Check your posture. Take breaks if you're sitting for long periods of time. Use the suggested lifting techniques and ask for help if something's too heavy. Take time to focus when you're completing a lifting task, especially if you're tired. Be familiar with any mechanical lifting devices before using and aim for consistency while communicating with the person being moved. If you feel you need more training on the equipment, bring that to the attention of your program manager. To complete the proper lifting course, submit the cover sheet and proper lifting tests to the training coordinator at the main office.